There's one question that confuses almost everyone researching a hair transplant. What's the actual difference between FUE and DHI? And right behind it, why do you have to shave your whole head for one, but sometimes not for the other? In this video, we'll clear both up completely. We'll walk through where these two techniques are identical, whether they split apart, what shave-in really affects, and how the choice between them is actually made. By the end, you'll know which question to ask your surgeon and what the answers should sound like. The extraction is the same, the implantation is what's different. In both Sapphire FUE and DHI, grafts are harvested from the donor area in exactly the same way. The split happens when those grafts go back in. In Sapphire FUE, we first open the recipient channel with a sapphire blade, then place the graft into them. In DHI, there are no pre-made channels. Each graft is loaded into a Choi implanter pen and placed directly into the scalp in a single motion. Same harvest, two different ways of putting the hair back. Because FUE needs the recipient area shaved to open channels accurately, while DHI places graft directly and can work through longer hair. In Sapphire FUE, the surgeon has to clearly see the angle, direction, and spacing of every channel before placing a single graft, and that visibility usually means shaving the recipient area. DHI skips the channel step entirely, so the implanter pen can work between existing hairs. That's what makes partial shave and no-shave options possible with DHI. One important note though, the donor area still needs trimming in both techniques. More on that next. Because that's where the grafts are extracted and accurate extraction needs visibility. No matter which technique places the hair, the follicles are always harvested from the donor. Trimming that area lets us use each follicle clearly, extract it cleanly, and minimize trauma to the graft around it. It also lets us pull density evenly across the donor instead of over-harvesting one spot. And that even distribution is what protects the donor long-term appearance. So the trimming you see at the back isn't optional. It's what makes a safe, balanced harvest possible. No, it's more discreet, not medically superior. The growth, density, and final result are the same whether the DHI is shaved or unshaven. The only real advantage of unshaven DHI is social. You can return to work or daily life without an obvious sign that you had anything done. Clinically, a shaved field often gives the surgeon more visibility and work efficiency. So if hiding the procedure matters to you, unshaven is a great option. Just don't choose it expecting a better outcome. No, shaving has zero effect on how transplanted hair grows or look long-term. Shaving only changes two things: surgical visibility during the procedure and your appearance for the first few weeks afterward. Once the hair grows out, there is no difference in the final result between a shaved and an unshaven transplant. What shapes the outcome is graft handling, angle, density planning, and aftercare, not the length of your hair on the day. Recovery is very similar between the two. DHI can sometimes create slightly less surface trauma in the reception area because there is no separate channel opening step. But that difference is small. Real healing speed depends far more on your skin type, how carefully the grafts were handled, and how well you follow aftercare. The name of the technique matters much less than the precision behind it. Both protect follicles equally well when they're done correctly. Follicle survival depends on graft handling, not the technique name. FUE gives very precise control during extraction. DHI gives very precise control during placement. The follicle is most vulnerable in the time between coming out and coming back in. So what actually protects it is speed, gentle handling, and a surgeon who does this consistently. A skilled team gets excellent survival with either method. A careless one damages graft regardless of which tool they hold. This is exactly where experience separates clinics. And after more than 13 years and more than 40,000 patients, full command of both technique is what let us match the method to the patient instead of the other way around. Yes, and in many cases, that's the best approach. It's not about picking a side. In a single session, we might harvest with FUE, build the hairline with DHI for maximum precision where it matters most, and use the Sapphire method across larger areas for efficiency. Scalp thickness and elasticity feed into these too. A thicker or less elastic scalp can favor the controlled placement of a DHI pen, while a more elastic scalp takes Sapphire incision just as well. The decision is always individual, based on your anatomy and goals, not on whatever technique is trending. So here's the short version. FUE and DHI extract the same way and differ only in how the hair goes back in. Shaving is about surgical visibility, not your final result. And the best choice often combines both technique rather than choosing one. At Vera Clinic, we evaluate your hair, scalp, and density goals first, then choose the method or the combination. That gives you the most natural, predictable result. If you want a personalized assessment, you can send us photos and we'll tell you honestly what your case needs. Links are in the description, and if this cleared things up, subscribe for more straight answers about hair transplant. See you soon!